Vibramycin, calcium, 50 mg per 5 ml oral syrup is a medication that is used to treat bacterial infections, including those that cause acne. It is also used to prevent malaria. This medication is a type of antibiotic called tetracycline, which works by stopping the growth of bacteria. It is important to note that this antibiotic only treats bacterial infections and will not work for viral infections such as the common cold or flu. Using antibiotics when they are not needed can cause them to not work for future infections. The recommended daily dosage and optimal timing for taking this medication should be discussed with a healthcare professional. Before taking Vibramycin, make sure to read the patient information leaflet provided by your pharmacist. It's best to take this medication by mouth on an empty stomach at least 1 hour before or 2 hours after a meal, as directed by your doctor. You should take this medication with a full glass of water unless directed otherwise. If you experience stomach upset, taking it with food or milk may help, but it may not work as well if taken with these, so ask your doctor or pharmacist. Remember not to lie down for at least 10 minutes after taking this medication. Make sure to take this medication 2 to 3 hours before or after taking any products containing aluminum, calcium, iron, magnesium, zinc, or bismuth subsalicylate. This includes antacids, vitamins/minerals, dairy products, and calcium-enriched juice. These products can bind with Vibramycin, preventing your body from fully absorbing the drug. If using Vibramycin to prevent malaria, take it as directed by your doctor, usually once daily, starting 1 to 2 days before travel. Continue to take it daily while in the malarious area, and for 4 more weeks after returning home. If you are using the liquid form of this medication, be sure to shake the bottle well before each dose, and carefully measure the dose using a special measuring device/spoon. The dosage is based on your medical condition and response to treatment, and for children, it may also be based on weight. For the best effect, take this antibiotic at evenly spaced times every day. It's important to continue taking this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. And remember to tell your doctor if your condition lasts or gets worse. Some common side effects of Vibramycin, calcium, 50 mg per 5 ml oral syrup antimalarial drugs include stomach upset, diarrhea, nausea, or vomiting. If these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as difficulty swallowing or signs of kidney problems. In rare cases, tetracycline drugs like doxycycline may cause increased pressure around the brain, particularly in women of childbearing age who are overweight or have had intracranial hypertension in the past. If you experience severe or persistent headache, nausea/vomiting, or vision changes, seek medical help right away. This medication may also rarely cause a severe intestinal condition called C. difficile. If you develop persistent diarrhea, abdominal pain, or blood/mucus in your stool, contact your doctor immediately. Prolonged or repeated use of this medication may lead to oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth or a change in vaginal discharge. In very rare cases, a serious allergic reaction to this drug may occur. Seek immediate medical help if you experience symptoms such as fever, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Vibramycin, calcium, 50 mg per 5 ml oral syrup antimalarial drugs, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have trouble swallowing or esophagus problems. Vibramycin, calcium, 50 mg per 5 ml oral syrup. Antimalarial drugs may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional before receiving any immunizations or vaccinations. Additionally, if you are planning to have surgery, make sure to inform your doctor about all the products you are using. It's important to be cautious of sun exposure while taking Vibramycin, calcium, 50 mg per 5 ml oral syrup antimalarial drugs, as it may make you more sensitive to the sun. Limit your time in the sun, use sunscreen, and wear protective clothing to avoid sunburn or skin irritation. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of using Vibramycin, calcium, 50 mg per 5 ml oral syrup antimalarial drugs with your doctor, as it may harm an unborn baby. This medication also passes into breast milk, so consult your doctor before breastfeeding. Additionally, children under 8 years old may be more sensitive to the side effects of this medication, especially tooth discoloration, so it's important to discuss this with the doctor. It's important to be aware of how Vibramycin, calcium, 50 mg per 5 ml oral syrup may interact with other medications. This can impact how well your medications work and may increase your risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Vibramycin, calcium, 50 mg per 5 ml oral syrup include retinoid medications taken by mouth, barbiturates, blood thinners, digoxin, anti-seizure medications, and strontium. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Vibramycin with others. If you're using it to prevent malaria, it's still possible to get the disease, so take precautions to avoid being bitten by mosquitoes. This includes staying in well-screened areas, wearing protective clothing, using insect repellent, and bed nets, especially from dusk to dawn. Remember that this medication is prescribed for your current condition only and should not be used later for another infection unless your doctor tells you to. Your doctor may also conduct lab and/or medical tests while you're taking this medication, so be sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Vibramycin oral syrup, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take double the dose to make up for the missed one. When storing Vibramycin, calcium, 50 mg per 5 ml oral syrup antimalarial drugs, it's important to keep it at room temperature and away from light and moisture. Different brands may have different storage needs, so be sure to check the product package or ask your pharmacist for specific instructions. It's important to keep all medications out of reach of children and pets, and to not store them in the bathroom. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's important to properly discard the product when it is expired or no longer needed, as taking outdated tetracycline-related drugs can result in serious illness. If you have any questions about the proper disposal of this medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.